It all began in the fall of 1991, when Kathy Antilla was 8 months pregnant with her third child.
It was about 2 weeks prior to my due date, and the nurse took my blood pressure and called the clinic and said her blood pressure is pretty high.
The next day, Kathy was rushed to the hospital for an emergency C-section.
He was just tiny. His head was as big as my fist. He was just skinny. He was just so thin. There was just nothing to him.
During the first few months of life, Isaac was constantly getting sick.
About the middle of October, he already had an ear infection. In November, we ended up in the emergency room, another ear infection, and this time too, an upper respiratory infection, probably bronchitis.
But whenever Kathy took Isaac to get checked out, the doctors didn't think that his symptoms were out of the ordinary.
And they'd say, well, his lungs are clear, his ears are clear, go home, you know, contact us in a few days if things aren't better. And a couple days later, we would be in, and then it would be bronchitis, it would be pneumonia, it would be an ear infection. And you just think there's going to be a day where he outgrows it. Like his brother had ear infections, he outgrew them.
But weeks passed, and Isaac didn't outgrow them.
Month after month after month, there was something. There was always something.
Finally, when Isaac was 9 months old, Kathy's pediatrician referred her to a pulmonologist.
I said, I have this little baby. All he does is cough. He's been sick almost every month since he's been born. He spits up all the time. And I said, I'm just really frustrated.
After a thorough exam, the pulmonologist diagnosed Isaac with asthma.
So now I'm thinking, yes, you know, it's asthma. That's why he's had bronchitis and pneumonia, and we're going to get this asthma under control, and it's going to be smooth sailing. So every day, morning, noon, and night, we would, you know, hook him up to his nebulizer, and he would have some breathing treatments, which did help the coughing somewhat.
In addition to asthma, the pulmonologist diagnosed Isaac with acid reflux, which he thought was causing the spitting up problem.